morning and welcome to Health Talk on AM 1270, 96.5 FM KXBX. Bill Kearney is back in the studio with me today. Bill, how are we?
Well, great. I actually drove in rather than take the boat in this morning.
You didn't have the canoe out, huh?
Yeah, beautiful sunshiny day. I don't know how long it's going to last, but we've had our share of rain, I think over 40 inches so far this year.
It's insane, yeah.
In Lakeport. So we're looking forward to the sunshine. We've got some real trauma going on in the county with people being evacuated, and the lake's up to 10.8 probably by tomorrow. Yeah. And that puts a lot of people underwater. So we normally talk about emergency health information that you ought to keep within your reach, and this is a good time to remind people. Even though you may not be evacuated yet, there's a good chance that you will be if this wind comes up, and we're supposed to have another rainstorm coming in this weekend. So emergency health information might be needed at a moment's notice. It was like during the fires a couple years ago and last year when people had to evacuate quickly, and we're having some people as late as last night that were told they needed to evacuate from their homes. And you may find it useful to store your information online or share it with your doctor, an emergency contact person, but you may also have access to a patient portal, which you can get through your physician. But either way, you need to know your health information. As we've told you many times, you need to be more responsible for your health than anybody else in your health care. So even if you have it online and you don't have a laptop or you don't have an iPad and your computer's underwater, it doesn't do you too much good. So as well as having it online, you should have a hard copy of it that includes your name, age, and sex, your address, your medications, names, doses, schedules. We went over this with you a couple of weeks ago, not realizing that you were going to need it as soon as this week. Your medical equipment that you use, whether you have a concentrator, whether you have a CPAP machine, your chronic medical conditions such as epilepsy or diabetes or hypertension, anything you take medicine for, high cholesterol, a medical consent form if or a DNR, so that's do not resuscitate if you are in that kind of shape that you don't want to be resuscitated. Parts of your health history that could be helpful to emergency medical responders, including allergies and immunization records. When we give you a shot, every time we immunize you, we give you a yellow card, or you bring a yellow card in from a previous immunization, and we add that to your card. In situations like this where people may not know what you've been immunized for, you're liable to get duplicate shots. That would probably be the best of all things, just to make sure you were immunized, but unnecessary. And then phone numbers for emergency contacts, such as your family doctor or local emergency service or road service providers or the regional poison center. In times like this, we're taking everything out of our cabinets and putting them on top of our kitchen counter or our table, and lots of times that includes poisons and medicines, and you've got little kids or grandkids or your own children, or maybe a daycare center that's involved where you're having medication available to young children, and it looks like candy and it's really medicine. So like I say, many people store this information online with the help from an app that you may have, and that allows you to access your information anywhere with a computer or a mobile device. And our phones now are our biggest source of a computer. So some tools also help you share information with your doctors, your family. The most important thing is to make sure it can be made readily available in an emergency or if you're unconscious. Again, these things sound rather drastic, but at this kind of disaster situation, and if you think it's not too bad here, look at your friends and relatives that are in these areas that are flooding quickly. I mean, one minute they're okay and the next minute they're underwater, including their houses, their cars, everything. So as with the fires the last couple of years, you think you're okay, and in a couple of hours your home is gone. Even the address of your home, because the home may be washed away or burned. You need to know the location, and usually we do, but in a time of trauma and disaster, many times those things skip your memory if you're older. So there's a couple of options for storing your information online, and that includes a free or a subscription-based personal health record. We call it personal health PHR or PHI, personal health information. It is like the electronic health team record that your doctor may keep with you, but with a PHR, you maintain it and determine who has access to it instead of the doctor. A patient portal, which many of your physicians have, they will give you a ID number that will allow you to come in online and give the staff and clients access to the electronic health record. In the hospital, we call it EHR, electronic health record. And then you print it out if you choose to maintain your information on paper, and I would suggest that you do this even if you have an electronic health record or a personal health record. Get it out on either a 3x5 note card, something you can put in your wallet, or even a folded piece of paper, and print a number of copies and keep them in handy places. Put a copy in your purse, in your vehicle, glove box, in the first aid and emergency kit. You could even try making one small enough to put in your wallet. Post it on your refrigerator door so emergency personnel can see it quickly if needed. So put the list on a cell phone or a thumb drive. So we've gone over this rather quickly, but these things happen rather quickly, and all of a sudden we realize, and guess what? I've made up a list for the many physicians and surgeons that I've gone to, but I never kept a personal health record in the computer or on my cell phone. And I was just going through my drawers on Sunday trying to organize some things, and I found a wallet card that you could write those things on, and I put it on a wallet card to keep in my billfold. That's fine unless I happen to go for a polar plunge like I did last week. And I want to remind everybody the Special Olympics actually had a polar plunge last weekend for Lake County at the Kelseyville Park in town. And because the lake was unattainable at the time and had a lot of debris in it, we had the Kelseyville Fire Department squirt hoses on us to get wet and raise a lot of money for Lake County Special Olympics. So I want to thank all the athletes that were involved in that exercise, and we raised a good deal of money for Lake County Special Olympics. This is their one big fundraiser a year. This money does go to the Special Olympics in Lake County, and I will tell you, many of those athletes were Special Olympics kids that were highly involved in the polar plunge, and they also raised more money than almost anybody else. So they were among the top fundraisers, and it was a great day of fun on a Saturday. And my wife and I dressed up like a couple of penguins and waddled out and and got sprayed with a fire hose, and the fire department was very gentle about squirting us with the hoses. We were standing out in the field at the Kelseyville Park across from the bank and the pizza place, and letting them squirt us. So if you didn't participate, it's something that you should put on your calendar. It's in February every year. All kinds of areas around the country do this, and they're usually around the same time. And usually we jump into the lake, no matter what the temperature is. It's usually around 48 or 50 degrees, and do that as a favor for the Special Olympics to raise money. So that was something that was quite fun to participate in, and if you get the opportunity, I certainly would do it in the future, because it is one of the menial things that we can do as citizens of this county to help those who are less fortunate than we are, and reach into our pockets, and it will go for a good cause, and it will stay here in Lake County. We've talked about opiates before, and about people being addicted to opiates, and we haven't really talked too much about dental pain and making a plan for dental pain relief. We used to get, when you had an extraction, you would get an opiate, usually for pain relief, which was usually hydrocodone or Tylenol and codeine. And in general, it did a very good job of relieving the pain, and it was a short-term amount of time that you were involved in getting the medication. But one of the ways that we have in the past, people that have been on narcotics or had trouble getting a hold of opiates, many times let their teeth rot so they can get a prescription for pain relief. So we can forget about Vicodin and Percocet and the other potentially dangerous addictive opioids. Over-the-counter pain killers may work better. We can use ibuprofen, anti-inflammatories, and Tylenol. It's a myth among dentists and patients alike that those opioid pain relievers are the drug of choice. Over-the-counter NSAIDs, which we call non-steroidal anti-inflammatories, are particularly do a particularly good job against dental pain, because you have to remember a narcotic will only tell the brain it doesn't hurt. It doesn't do anything about causing the relief of that pain. If you're taking a non-steroidal anti-inflammatory, it reduces the inflammation and swelling that's causing the pain. And then if you take something like Tylenol along with it, that actually addresses the pain part. So it is a analgesic, we call it, to help curb the pain. It doesn't address the inflammation, but it works well against that kind of pain, in a dental pain. So, and better, in fact, than most opiates. So we are constantly looking for a better way to treat people without, especially that are undergoing any kind of dental surgery, and make up a plan with their dentist or oral surgeon about how they're going to manage the pain. If you've provided a thorough medical history so that your doctor can recommend pain relievers that are the safest for you, most people who take blood thinners or have advanced kidney disease should avoid non-steroidal anti-inflammatories if possible. And it's important to know that taking too much of any kind of pain medication, even over-the-counter medication, isn't safe. So start with steps to reduce the dental pain immediately after your procedure. If your dentist uses a long-acting anesthetic to keep you numb longer and injects your gums with a steroid to reduce the swelling, you can probably just use cold packs at home and take a non-steroidal anti-inflammatory before that wears off. So a custom plan for relieving the pain for dental type of surgery would be a pain level reliever, which would be over-the-counter non-steroidal anti-inflammatory if it was mild, like ibuprofen, Advil, Motrin, Aleve. If you are getting a prescription strength non-steroidal anti-inflammatory or anything like that is agreeable with any kind of condition you have, you don't want to ever exceed the dose of that pain reliever recommended on the label with your provider's okay. For example, non-steroidal anti-inflammatories can go up to 3,200 milligrams a day. That would be 4 of the 800 milligram tablets, and it would be, let's see, 4 times 800, 1632, right? And that would be the maximum you would want to go. So, and then sometimes you want to add a generic Tylenol or acetaminophen with it. So if it's really severe, then a non-steroidal anti-inflammatory and an opioid for the first 24 to 48 hours. And some people have that much trauma in getting their teeth pulled and will have a considerable amount of pain because, for example, people used to get all their teeth pulled at one time if they were getting false teeth, and that would be a very traumatic thing. Today we try to save as many teeth as we can and do implants. If you wind up needing prescription opioids, your dentist would only prescribe enough to cover the first 2 or 3 days. After that, you should be able to comfortably transition to other forms of pain relief. So, and many times we find people that are seeking opiates that are already getting opiates for a chronic condition, such as after surgery or chronic back pain or something, and they're already getting pain medication, and they fail to tell their dentist that, so their dentist prescribes more. And because we fill your prescriptions for you, when we bring it up, we see there's a duplicate medication being offered, and we will call the dentist and say, Mr. Smith is already on oxycodone 10 milligram, and I'm not sure that he needs Tylenol 3, but we want to make you aware of it, because your dentist can phone the Tylenol 3 into the pharmacy. The oxycodone he has to write a prescription for. So other types of prescription opiates are Schedule II, which means they have to write a new prescription or electronically submit it to the pharmacy. So, and then the last thing is, you're liable to have leftovers. Many pharmacies, hospital clinics, narcotic treatment programs will take leftover and expired medications. We are prohibited in the state of California right now from taking back controlled substances, but there are safe places where you can to find an authorized medication take-back program, and we didn't have one in Lake County a couple of weeks ago. You can go online and ask for those. But mainly don't leave it hanging around. A lot of people want to keep it for the next time they get pain, and it really conflicts with what the physician is prescribing at the time to treat the condition that he's involved with. So, and if he or she doesn't know that you're taking an opiate already, they're liable to prescribe more. And then somehow it gets into the system, it gets out in the community, and you never ever see excess opiates in somebody's cabinet that's a seeker. If they aren't using it, they'll sell it to somebody else. So, and I'm not talking about Mr. and Mrs. America or Miss and Mr. America. I'm talking about people who are seekers for narcotics. And there's always a market out there on the street for something. It may be expired medication. It may be medication that you have no idea what is in that medication, and that's what we're finding out more and more on the street, that these Hycodone or Vicodin or Hycodone or Oxycodone many times is not that. It's fentanyl or a drug a lot more potent than fentanyl, and people are dying. So we're doing everything we can to control that, and just the dental part of it isn't pointing the finger at dentists. It's just telling you that there's another source out there that the DEA is looking at to make sure that they're being prescribed the right kinds of medications. And I for one, don't know of any dentist that's a source of getting opiate medication in high quantities or high strengths to handle dental pain in Lake County. We talked a little bit in the past about standing up to diabetes, and if you could walk for about 10 minutes after every 30 minutes or so of sitting, that it would do good. I don't know how your bosses would tolerate you taking 10 minutes off every 30 minutes and walking around, but you probably have to pattern those during your break time. But it really improves blood sugar levels slightly more than riding a bicycle for 60 minutes before 13 hours of sitting. So it's a way to try to keep exercise involved in treating diabetes, and it's a way that many of you should at least look at the opportunity. If you're sitting at a desk all day long, whenever you get a chance, get up and walk around. Maybe it's to the back of the building. Maybe it's just around the parking lot. But lots of different ways that you can get exercise and keep your activity level up and your glucose level down. So we're going to take a break, and when we come back, we're going to talk about double checking your blood pressure and how much that keeping your mind and memory sharp will help you to avoid dementia and Alzheimer's. Hey, all you weekend jocks, listen up. As we get into winter, workout plans change. Instead of playing softball and soccer, we're working out in the gym, playing basketball, or running on the treadmill. Use the RICE method to treat an injury right away, so on Monday when you go back to work, no one ever knows you aren't the macho guy you want everybody to think you are. The RICE method is rest, ice, compression, and elevation. Rest. For most injuries, rest the area until the pain decreases. Ice. Ice is the most effective treatment for reducing inflammation, pain, and swelling of injured muscles. Apply ice as soon as possible after an injury, even if you're going straight to the doctor. Compress. Between icings, wrap the injured area with an elastic bandage to help control swelling and provide support. Elevate. Raising the injured area above your heart to help reduce swelling by draining excess fluid. And at night, place a pillow under the area to support and raise it. Northlake Medical Pharmacy, with 2 locations to serve you. Hill Road next to Sutter Lakeside Hospital and outside the Bruno Shops Mall.
Okay, here are 5 important reasons why your son or daughter should play a high school sport.
Number 1.
High school sports teach valuable life lessons like self-discipline, sportsmanship, and time management skills.
2.
Teens who play a high school sport have better grade point averages and fewer disciplinary problems.
Number 3.
High school sports help fight teen obesity and substance abuse.
Here's number 4.
High school sports provide wholesome, constructive after-school activity, perfect for today's families.
And number 5.
And high school sports are safer than ever before. Injury surveillance and research, better equipment, and the continuing education programs for coaches provided by state and national athletic associations have made high school sports safer than ever before.
This message presented by the California Interscholastic Federation and the California State Athletic Directors Association.
SSS.gov presents the world's easiest to-do list.
Done.
It's quick, it's simple, and it'll keep you out of trouble and eligible for great benefits. If you're a man turning 18, go to SSS.gov and register with the Selective Service System.
Done.
It's an easy way to keep the door open to great benefits like college loans and government jobs. And it's the law. Go to SSS.gov and register now.
Done.
See? That was quick.
I'm Dr. Jackie Duncan. When my daughter asked me to come to her school to talk about my job, I wasn't sure if clinician scientists would be very interesting to her classmates. But when I told them that my research might prevent their grandparents from losing their sight, that got their attention. I'm working with the American Health Assistance Foundation to find a cure for macular degeneration, a debilitating eye disease. Macular degeneration is a leading cause of vision loss for people over 60, affecting over 11 million Americans. It's important to let young people know how to take care of their sight. I told the children about ahaf.org/kids, a website created just for them. Here, families learn about the disease using interactive games, stories, and other activities. Visit ahaf.org/kids or call 1-800-437-2423 for free information about macular degeneration. That's ahaf.org/kids or call 1-800-437-2423 for free information and resources.
Okay, Bill, we're back.
All right, we're back, and we're trying to keep our mind and memory really sharp, giving ourselves tests. I've got to get back to giving you more tests, Paul.
Oh, okay,
so
yeah,
you
no.
can be sharp, but
Yeah.
today I don't have one. I'm just trying to figure out how to remember to bring one. But we have to. We were talking a little bit about blood pressure coming up, and about 1 in 6 people in a recent study of about 1,000 adults had blood pressure levels that were normal during a doctor's office check, but higher at other times. And this so-called masked or hidden hypertension was found when the subjects wore blood pressure monitors for 24 hours. In your office, blood pressure is in the pre-hypertension stage, 120 to 139 for the upper level, and 80 to 89. You might benefit from a 24-hour monitoring. I think that the 24-hour monitoring just adds more anxiety to people. You know you're wearing that cuff. You know it's being measured. And I think that wasn't a huge study, 888 people. I think that when you have a much higher risk of showing higher blood pressure when you're in a physician's office, which is called white coat syndrome, and because you know that it's going to be written down, and you know that if it's not, if you just left the office and somebody had just robbed you or threw bricks through your window or whatever it is, and you had a doctor's appointment and you go in there and it's high, you certainly don't want them to increase your blood pressure medication or put you on blood pressure medication, because that one time the smart thing to do is for the physician to tell you if you don't have a blood pressure cuff to get one, and for 30 days take your blood pressure at a couple of times a day and record it, and then bring it into the office and let's see what it is compared to what you're getting in the office. So and then Paul and I were talking about keeping your mind and memory sharp, but and there's so many things out there that are being sold that says you need to take this pill to keep your memory sharp, and really there isn't anything for that. You can rule out other factors. Memory and thinking problems are sometimes related to concerns your doctor can help you resolve, such as depression, or some medications such as sleeping pills. Even though the sleeping pills are supposed to help you relax and get some sleep, they do have an effect the next day. You're not as sharp as you would be normally until they wear off. Controlling your blood pressure, untreated, has been linked to cognitive impairment, which we've talked about before. Able to perform just daily activities may contribute to the insufficient blood flow to the brain. There's things you can do besides just testing and things, and that's avoid smoking, which is a definite deterrent to keeping a sharp memory. Consume alcohol only in moderation. Try to get 7 to 9 hours of sleep a night. Take your hypertensive medications as recommended. Older adults, as people age with untreated hypertension, have a lower risk of dementia after 6 years than those who didn't take such steps if they're taking medication. So try to get regular exercise. People who are sedentary and just sit there at a higher risk of cognitive problems because it increases circulation. So the more that you exercise, get about 30 minutes of anaerobic activity, such as a brisk walk on most days. And research has kind of been mixed about aerobic activity alone. Adding a few strength training exercises will help. For example, I swim all the time. Swimming does not give me any, it builds muscle, but it doesn't give me a lot of strength in my legs. It does in my arms and my chest, but my legs it doesn't, and that's where my last surgery was in my femur, and I need to do some things about weight and balance with those. And I really, although I sell vitamins, there's a variety of nutrients, including vitamin E and beta carotene and B6 and B12 and fish oil that may help in preventing some cognitive decline when is eaten. They're part of a balanced diet, but the same evidence is not in there for supplements. I don't promote supplements mostly in my pharmacy, but if I do promote the B vitamins, B6, B12, B complex, fish oil. There is no question that getting the natural sources of it is better for you, but that doesn't mean it isn't effective if that's the only source you have, is to take those drugs. It's over the counter. It's pretty hard to overdose these. With all the dietary supplements out there that are loosely regulated, you can't be sure exactly what you're getting, and that's why we don't get mail order medications. We don't know. We don't actually buy Costco medications, which many of you do in large quantities because you've brought them into my pharmacy as I've done a brown bag review for you. We just have our own manufacturers and don't buy from companies that we don't have a high amount of respect for. So if you're thinking that you're becoming forgetful, if you're upsetting when you walk into a room and you don't remember until a little bit later about why you're there, I think we talked about last week when I was at Stars and talking to an individual, and they wanted to talk to me about something related to healthcare, and I said, now what was it you were, and I was interrupted a couple of times, and she says, I don't know. I can't go walk back in the other room and come back because I've been standing here the whole time. So that's a natural thing. If you find yourself struggling to retain information you've just learned, or if memory lapses are permanent or kind of paired with inattention, you leave the stove on all day or get lost in a familiar place, tell your doctor. But I find most of the time that these things are things that just occur during the aging process. If it's something that affects your safety, like leaving the stove on all day or something, then I would be more concerned. Or leaving a place and not remembering how to get home is certainly one issue that needs to get somebody's attention. This next issue I have debated for a long, long time because I'm a victim or a patient in this. And it was, does good cholesterol still matter? We have LDL, which is the bad cholesterol, and we have HDL, which is the good cholesterol. And for years, bad and good cholesterol have been the yin and yang of heart death, and the two lipids, which are fats, around which so much advice becomes so important. And bad cholesterol, which is the low-density lipoprotein, deposits excess cholesterol in your arteries where it can build up in plaques, increasing the likelihood of heart disease and, of course, blood clots. So good cholesterol, which is the HDL or the high density, carries surplus cholesterol back to your liver so that it can be excreted. They always want your LDL, your bad cholesterol, to be a lower number, and they want your HDL levels up as high as 45 milligrams per decimeter, which is considered a good target. Mine is around 25 to 32. Sounds pretty straightforward, right? But trying to get HDL up to those levels, there has been little ability to lower heart disease risk, and more is not necessarily better. So there's new evidence on HDL, which is the good cholesterol. The first clue that the role of good cholesterol was more complicated than previously thought emerged when scientists tried to develop medications to raise HDL levels. The drugs they tested were niacin, protein pump inhibitors, but they failed. They raised the HDL level, but they failed to reduce cardiovascular disease risks, meaning you were just as likely to have a heart attack or a stroke with higher HDL or lower HDL levels than you were if you'd raised it higher. So it surprised doctors, because we know that certain lifestyle changes, such as exercising more and quitting smoking, drive HDL levels up and heart disease risk down, but increasing HDL levels artificially without behavioral changes doesn't reduce the risk at all. Now, some of your physicians, if you go to them and tell them that Bill Kearney said on Health Talk that I didn't need to worry about my HDL, if they're cardiologists, they may say something different, or an internist. But it turns out that HDL is not a very good therapeutic target. Once more, the research says that above a certain threshold, more HDL could increase health risks. So they looked at a huge study, to me, 631,000 people, and found that those with HDL levels greater than 70 in men or 90 in women were more likely to die for reasons unrelated to cardiovascular disease. Now, I'm not telling you to stop taking your niacin. I'm not telling you to stop taking your PPI, but it has to get your attention somewhat. So as researchers work to figure out what these findings mean, it's the quest to keep your heartbeat healthy, and your doctors might still use your HDL levels and LDL levels to help predict your risk. The experts at Consumer Reports say that very low HDL levels can be a sign of trouble, and that the only meaningful way to raise them is through lifestyle changes. There's no evidence for benefit from any of the drugs. And this came from the Cleveland Clinic. It's still important to pay attention to the numbers. I guess, in other words, if your HDL level is low, high, or somewhere in the middle, the prescription for a healthy heart will be about the same. Don't smoke, drink in moderation, all the same things. Exercise, the right kind of diet. Everybody agrees for the pursuit of a healthy lifestyle, but that doesn't mean, it gets to be, if we write down everything our health practitioners, our pharmacists, and our nurse practitioners and physicians say that you need to do to maintain a healthy lifestyle, sometimes you become a prisoner, and the quality of life just isn't there anymore, because you're so afraid you're going to do something that will shorten your lifespan. I, for one, don't want to live to be 90-some or 100 years old, because I don't think very few of us at that point have quality of life. But a lot of people have that goal to be a centurion and live to be 100 years old. I have a friend that will be 100 years old on April 1st. And other than a hearing problem, he's in pretty good health. So I think to do everything in moderation. I, for one, am not going to be as concerned about HDL, which is the good cholesterol, as I have been in the past. I still exercise a lot. I still try to eat a healthy diet. If that doesn't do well for me, then I'm probably going to walk out in front of a truck or something and die anyway. So I'm just going to do the best to have a quality of life that I enjoy, and do things in moderation, and not be so concerned about some of the issues that I can control. But I certainly don't want to be taking any more medication that probably isn't doing me any good. And the niacin is something that, although it's over the counter, it can eventually cause some kidney or liver problems. And you get a flushing effect from taking it that makes it a little bit uncomfortable. I just don't need to go through those at this time. I'm not telling you to avoid taking the medication you may be taking for lowering your HDL, but I would really focus on the LDL and total cholesterol, and try to function on something that you know that you can maintain, and try to have a healthy activity level and a healthy diet. A lot of people wonder if they can they buy these orthotics from the drugstore and help their foot pain, or do you need a prescription product? And I'm not telling you that these are completely equal, but we sell insoles, and Dr. Scholl's insoles and Dr. Comfort insoles, and if you get a prescription for a diabetic shoe, a Dr. Comfort shoe, we order the insoles custom made, just like we do the shoe. So you don't always have to have a custom made orthotics that can cost several $100s for many types of foot pain. These other insoles will work just as well. I don't mean that you should not go to your podiatrist and have them tell you what you need, but I also would ask them if they thought that that it would be a help if you bought something that was over the counter. We have a lot of people coming in right now for dry skin, and one of the questions is if hydrocortisone cream or ointment is safe and can help itching caused by bug bites and allergic skin reactions and psoriasis. But using the topical steroid for more than 2 weeks can really thin your skin. That's whether it's on prescription or whether it's over the counter. Most of this, if it's a bug bite or an allergic reaction, that will disappear rather quickly. If it's just dry skin from the winter and not getting enough moisture in your skin, you're better off to take a fragrance-free moisturizer 2 or 3 times a day, and it will put moisture in your skin without drying it out. Cortisone types preparations many times will dry your skin more, and it could be actually causing the condition to get more uncomfortable than it is already. So certainly if you're going to a dermatologist, have them tell you whether or not you need a moisturizer or whether you need a steroid type cream. If they prescribe a medication, it probably will be a prescription medication that is Desinide or triamcinolone or something like that that has a lot more potency than a 1% hydrocortisone cream or gel. So another issue that I'm just passing through is a lot of people have complained to me lately about pains in their feet and their hands, and wondering why it's so much more intense right now. Well, a lot of people, especially older people, a leading cause of hand pain and foot pain in adults is osteoarthritis, which is when the cartilage that cushions the ends of those bones wear out, and it happens in your feet and hands just like it happens in your knees. And there's been a lot of controversy over this, but I can tell you, and my orthopedic surgeon can tell you, that when the weather changes like this and a low front comes in, the atmospheric pressure changes and you can feel it in your bones. And I was just to my orthopedic surgeon a couple of months ago, and he said, you're going to hurt. That's why a lot of people go to the desert in the wintertime for a drier kind of atmosphere where they're not getting these low pressures that affect their bones. This can cause pain and stiffness and swelling. I wear these copper gloves at night because I have neuropathy really bad in my hands, and they burn, and I get cramps in them. And it's always worse this time of year, and especially this year. So if you have reoccurring hand pain or it lingers more than a few days, and you can determine whether it's arthritis or a stress injury is to blame, go see your physician and see what they say if you think it's that serious. especially mine is repetitive. So a lot of what I talk about I experience, and I know what low back pain is, as we've talked about before. I know what neuropathy is. I know what osteoarthritis feels like when you've had as many surgeries as I have. You're bound to have scar tissue and arthritis in those places. So just be aware that we can't always change as we begin to age what we're doing and whether or not we need to get on medication or just endure the pain, but certainly quality of life is an issue. Last year the task force from Preventative Services recommended that a vastly large group think about taking LDL lowering medications. If you're 40 to 75 and have diabetes or high cholesterol or blood pressure or smoke, you're now advised to have a doctor estimate whether it's a major cardiovascular event risk or not within 10 years. And the chances are 10% or greater. The task force suggests that a statin for risks of up to 10% suggests that you consider a statin. I want you to know that statins, there's a huge amount of people that are taking statins right now. I would say a huge percentage of the population over 60, and a lot younger than that. And there are definitely side effects from taking a statin, and they can be serious side effects. One of those is memory loss. Doesn't have to be major, doesn't have to happen to everybody, but it still can be a factor. And if you're going through the aging process and already experiencing some memory loss, that can certainly add to it. The other one is some sort of a muscular pain that makes it very uncomfortable for you to be active in many cases. And just in the last 2 years, we started for standard of practice prescribing atorvastatin 80 milligram. Hardly anybody took 80 milligram before as a preventative after they've had a cardiovascular event, heart attack or a stroke. 80 milligram, most people were taking 10 milligram. So that's been relatively new that we've been giving those high of doses on as a patient is getting out of the hospital from a cardiovascular event. Probably too soon for us to tell whether the side effects have increased substantially from people taking it. Normally what we tell people when we give them a statin or fill a prescription for a statin for the first time, we'll tell them to look for those kind of side effects. And if they occur, to let the doctor know immediately. And sometimes just changing the statin from atorvastatin to simvastatin or lovastatin can alleviate that side effect. And you'll still be able to maintain your effective dose of an anti-cholesterol medication. But many times that doesn't work, and you have to go to other sources for reducing your cholesterol, and those are not nearly as effective as statins are. But again, what we talk about all the time is risk versus benefit. Can we afford to take that risk? Is our LDL level or cholesterol level so high that we need to get it down and then maintain diet and exercise? And one thing about atorvastatin opposed to simvastatin and pravastatin is that it takes it down much more quickly. The chances are, in that period of time that it takes your bad cholesterol down, you can change your health plan to a better diet and more exercise and maintain that low level. People don't like to change lifestyles, especially if the medication isn't that costly. We have coupons that come out by manufacturers now for brand name medications. Supposed to lower the cost. The new coupons that are coming out for EpiPens sometimes have no copay at all, and they have a $100 coupon through the drug company that pays the balance. I just saw one yesterday that had a coupon for an estrogen, and the copay for this person for a 30-day supply was $99. that isn't a good price for a consumer to have to pay for an estrogen product that they need as they go through the aging process. So be careful about these coupons, and be careful about and if you're on a Medicare plan or a Medicare D plan or a Medi-Cal plan, you can't use these coupons and go through insurance. And if the federal government finds out that we're allowing you to get that medication with going through their insurance company, it's a violation against the federal law. So anybody that's on a government program, a workman's comp program, a Medicaid D, Medi-Cal D, Medicare D program, Medi-Cal or Medicaid, it's illegal for the consumer to use those coupons, and you will see them being advertised on radio and television and in magazines, and get the copay down to zero, but you can't go through those health plans in order to do that. So you want to get the benefits that you're certainly entitled to, and as we go through this healthcare crisis, we don't know what the future is going to allow as far as deductibles, as far as pharmacy benefit managers, as far as anybody being involved with changing the price on healthcare products, including prescriptions. We want to remind you that we're doing a free delivery service if we can get to your home to deliver prescriptions in Lakeport, Nice, Lucerne, Upper Lake, and the Kelseyville, Buckingham, Riviera areas. If you're going someplace else, transfer your prescription over to us and we will deliver it to you at no cost. Give us at least a day ahead of time to get the prescriptions transferred to you. And we're still doing immunizations for not so much flu. And speaking of flu, it ends up only being 48% effective this year, but if you can cut the risk down to half, it's worth taking the shot. The problem is that flu vaccine, as they have evaluated, mutates during the year and becomes something different by the end of the season. I'd like to remind you we're Northlake Medical Pharmacies with 2 locations for you at 5136 Hill Road East across from Sutter Lakeside Hospital. Call us there at 263-6192 and outside the Bruno Shop Smart at 347 Lakeport Boulevard. Give us a call there at 263-1328. Thank you, Paul.
Thanks, Bill. We'll see everybody back here again next Wednesday for Health Talk on AM 1270, 96.5 FM KXBX Lakeport.